Hi everyone, I am back. Taiwo Adeshigban, physical therapist, former athlete, and today I am going to be talking about the Broström procedure. If you've missed my ankle injury series, I first started talking about ankle injury sprains. I had an athlete recall her experience and provide some insights on things she would have done differently. My latest blog post, I talked about chronic ankle instability, and today we're going to actually talk about a surgical procedure that is not commonly needed in the majority of those that suffer an ankle sprain, but there is about 20 to 25% of individuals that will require this surgery. I do want to personally thank Eric Giza. He is a surgeon out at UC Sacramento, California, for all the insights regarding the Broström procedure. The individuals that will require this surgery are those that have completed formal physical therapy for at least 6 months and are still experiencing issues. Now, there is an exception. Your ATFL ligament is a commonly injured ligament when you sprain your ankle, and it's not a ligament that has a ton of blood supply. So for some people, they may do physical therapy, but they still have instances of instability affecting their activities. Your surgeon will look at things such as your range of motion in your ankle, how loose those ligaments are, but they commonly will order stress radiographs while they are completing specialized tests to assess the integrity of the ligaments. And it's not uncommon to also order an MRI to make sure that they're ruling out any cartilage involvement. Your surgeon will want to also have an idea of whether this is a functional or mechanical issue, and at times it may be both. Mechanical instability essentially is the ankle moving past its physiological motion, so there's just an increased looseness in that joint. Whereas functional instability, these may be individuals that may have a reoccurring ankle sprain, but they really only notice the feelings of giving way when they're partaking in their activity. Brostrom. Let's get to the Broström procedure. What exactly is this? Essentially, it's a surgical procedure done to address the ankle instability by repairing or tightening the ligaments. Now, I won't go into depth about the particular procedure, but it is found that doctors vary depending on if they're going to do just a modified Broström. Now, if there is an extent of damage done, some surgeons decide to do an internal brace as well as with the modified Broström, and I won't go into details about that, but if you have any questions, you can hit me up in the box. After surgery, one huge consideration you want to be thinking about is being sure that you're protecting this ligament. There's a fine line between stressing it a little bit, but not overstressing it where we're stretching out this ligament. And your doctor, as well as your physical therapist, will be able to be sure that you're educated on your limitations and being sure that you don't apply too much strain on the ligament in order for it to heal. Your weight-bearing status will be truly dependent on the surgical procedures and what structures were involved. For example, a modified Broström, just repairing of the ligaments, you may be non-weight-bearing for a couple of weeks, whereas a modified Broström and an internal bracing, a lot of surgeons have their athletes weight-bearing with an air cast because they have had that internal brace to provide more support. And then we're going to talk about cartilage involvement, because if you do have some kind of cartilage repair that needs to take place, you obviously can't put too much weight on that ankle. Initially, you may be placed in a boot for about a month as you progressively bear weight and get that ankle moving, but then your surgeon will then have you into a smaller brace depending on how you're doing. Now to the physical therapy aspect. Normally, these candidates start physical therapy by week 2 to help address things such as pain, swelling, make sure that it's healing appropriately. But then by week 4 to 6, you will then begin to get involved in the active range of motion exercises, again in a protective motion. By week 6 to 8, we're going to be incorporating more balance activities. And then by week 8 to 12, we're talking about more of the plyometrics, so the jumping, the explosive motions. Now, if you are returning to an athletic activity that requires a lot of demands on the body, by week 16, that is when you'll be incorporating some dynamic cutting, accelerating, and things like that. So definitely 4 months is going to be needed at the minimum. Four, quattro. Let me say that again. 4 months is the amount of time that most athletes will need in order to retrain their body to perform those certain movements with the ankle. And I want to strongly suggest you mark that down, because some athletes will find themselves struggling after returning to their sport because their ankle is still stiff. They aren't feeling as stable because they have returned back to their sport too soon. If this is a procedure that you think you may need, don't wait a whole year to figure that out. Go see an appropriate healthcare provider. And I say this because the longer that you let your ankle instability go on, that's more damage you could be causing to your articular cartilage, which could cause you to have earlier arthritis. Now, for those of you that have to do the Broström procedure, do realize that this increases your risk of having earlier arthritis. What is the answer to preventing this altogether? For some, this is unfortunately their last resort. But for many, if you've suffered an ankle sprain, a good portion recover after physical therapy. So don't take your ankle sprain lightly if you've injured it. Go see a physical therapist and let them help you rehab it completely so you're not put in this situation. If you have any questions, feel free to hop onto my website. Be sure to subscribe for updates. Next video is going to be of me demonstrating ankle exercises, and it'll be a little cool. So stay tuned. See you later.